Hello, my name is Dr. Burdette from Precision Point Diagnostics, and I want to talk to you about the importance and the role of oxidative stress. This is the profile, the Advanced Oxidative Stress Profile by Precision, and we are the only lab in the country that looks at not only total glutathione, but also percent reduced glutathione. This is important, particularly right now when we're thinking about COVID, but also in chronic disease. In chronic disease, for example, autoimmunity, many patients can have a normal total level of glutathione, but their percent reduced suffers. Why is that? Because in the state of chronic disease, when there's lots of inflammation and cytokines, you use up the glutathione that is present, and we need to put emphasis on recycling the glutathione or reducing the glutathione again back to its active form. Total glutathione makes up both your percent reduced as well as your percent oxidized, and it's that percent reduced that's in the active state that can help us in terms of chronic conditions. So right now, as we're thinking about what is most important in terms of patient care, of course, on our minds is prevention, and in case of one becomes infected, reducing the symptoms of COVID. And the research seems to indicate that a depletion in glutathione could be one of the critical factors that dictates whether or not someone's going to be relatively asymptomatic or have much more difficulty with a condition like COVID. What we see is that glutathione is able to cut off that cytokine storm. It's able to help to attenuate overactive inflammation. And of course, we know that glutathione is already low in chronic conditions, conditions like diabetes, heart disease that we know are comorbidities that can worsen our outcome in COVID. When they stratify and look at patients who have higher levels of glutathione, these are the ones that end up being relatively asymptomatic with less complications. So understanding our patient's level of glutathione right now is critical as we move through this world of infection and thinking about how to protect our patients. In fact, the inflammatory response can be tracked right back to how COVID enters the body. We know the viral entry happens through ACE2 receptors, and these ACE2 receptors will result in production of angiotensin 1 or 2. And so when we trigger ACE, this causes more vasoconstriction, oxidative stress, and this is exactly what the virus does. It will decrease ACE2, which causes more vasodilation, which is anti-inflammatory and antioxidant, anti-apoptotic. So the receptor which COVID uses to enter the body begins to trigger and compete with antioxidant processes, putting us in a state of decreasing glutathione. Some of the reasons that we need glutathione is because it's so protective. First of all, by neutralizing reactive oxygen species that can go on to damage the endothelium, go on to damage the tissue and also organs. The next reason that we need glutathione is because it helps us to clear xenobiotics. In fact, when we go through conjugation, when there's an increase in activity of cytochrome P450 enzymes, we're then reliant on phase 2 conjugation. And a byproduct, for example, of conjugation produced from use of acetaminophen is NAPQI. This can be damaging, and we need glutathione to move it out of the body. Another reason that we need glutathione is because it is a substrate or a cofactor for many of the enzymatic processes in our body. The cofactors that produce anti-inflammatory prostaglandins that help us to produce and squelch inflammatory leukotrienes, the glutathione is necessary there for the production. Also, glutathione is used to synthesize S-nitroglutathione, which will protect us from reactive nitrogen species and will help us to produce the correct level of endothelial nitric oxide. So that is not only a process that's dependent upon arginine, but it's dependent upon reducing oxidative stress, which glutathione is a major player in. We know the need for glutathione is ubiquitous. It's the major intercellular antioxidant in the brain, in the lung, in the kidney, in the liver. But it is that reduced glutathione that is doing the majority of the work. So we need to know, do we have enough glutathione, and do we have it in the right state to be the workhorse? We know that glutathione decreases depression, cancer, cardiovascular disease, dementia, and the challenges faced by even acute infections like COVID, helping to protect us from the impact of a cytokine storm. So it's always important to know our patient's level of oxidative stress. We want to know their major intercellular antioxidant, total glutathione, but then we want to know, is it reduced? Because if total glutathione is low, we'll give glutathione to increase that. We'll give N-acetylcysteine to increase that. But if the percent reduced is low, now we need to use things that move it from that oxidative state back to the reduced state. And those are things like alpha-lipoic acid or selenium. Also included on the advanced oxidative stress profile is F2-isoprostane, and this is a marker of lipid peroxidation. How oxidized are the fats in your body? When this is elevated, it means you lose membrane fluidity. When this is elevated, it means that you are going to damage lipids that increase risk of cardiovascular disease. When this is elevated, it means that even the good fats you take in, like omega-3s, are more at risk of becoming oxidized and meaning that you are unable to use them in the body. For example, studies show when F2-isoprostane is high, the omega-3s that we take in are likely to become oxidized, and when that occurs, they don't get incorporated into our brain or our myelin sheath like they should. Finally, 8-OHDG is a marker of DNA damage. It goes up as we damage the DNA, which increases our risk for cancer, but it also goes up when there's damage to the DNA in the mitochondria, so we can think of it as a mitochondrial marker as well. It is imperative that we know people's levels of oxidative stress if we're going to protect them from the impact of things acute and the impact of things chronic. Thank you for taking a minute to update yourself about oxidative stress and how critical it is to our patients. Please contact us. We have promotional specials going on this month, January and February. If you email us, we will give you that information on the discounts that we're running on these profiles right now. We really want to make factors like this accessible to your patients, make sure that we're in a state for ultimate prevention.